These are the clinical correlates for our pathology flashcards for module number 7. We're going to start with Osgood-Schlatters Quiz. So pause the video here and do the quiz questions and then restart the video. Osgood-Schlatters is a disorder of the knee, and we see that this happens in our patients who have pain over their tibial tuberosity. So the pull of the quadricep is so much stronger than the quality of the bone. So our activity modification is going to reduce the quadricep activity, and by reducing the quadricep activity, it's going to reduce the pull on the bone. This happens in adolescence. So we know that the bone isn't fully strong enough, it's not an adult bone yet, and therefore it's going to be a little weaker and allow that excessive quad pull to create an excessive bump, or I like the word excessive today, a large bump over the tibial tuberosity. Ice might be an option to help reduce some of the pain. We may be doing stretching to the quadricep to loosen it up and so that it's not constantly tugging or pulling. And then balance the mechanics. Oftentimes these patients are overtly strong in the quadriceps and they need probably a little bit more work on the glutes or the hamstrings. So balancing the mechanics and getting good quality mechanics. So maybe they're squatting with too much quad and instead jumping with too much quad work. Instead we need to work and focus on glute activation, and that will make it easier and less painful for the patient. Here is your questions for rheumatoid arthritis. Pause, and then we'll return. Rheumatoid arthritis treatment is really about the interdisciplinary team. We are going to need to be working with pharmacists, with doctors, with OTs, with athletic trainers, everyone to treat rheumatoid arthritis because it doesn't just affect the joints, although that's usually what we care about so much. During a flare-up, so when they're actively aggravated, we're going to do stuff to calm it down. Ice, gentle passive stretching. Talk with them about using an assistive device because if it hurts to walk and you're walking with bad mechanics, use the walker. The walker will make it easier for you to reduce that inflammation. We may need to splint. You can see the hands here have some issues going on. You can see there's some nodules forming here and there's a joint erosion, and we'll see that the fingers will drift. It's called ulnar drift. So we don't want the fingers to drift ulnarly, so they'll kind of drift to the side a little bit and that they become unusable. So we want to splint in advance so that the patient maintains as much hand function as possible. Whole body treatment. Remember that exercise is a very powerful thing that we could provide our patients with, but we need to make sure that it's graded exercise so that they are feeling better with exercise and not feeling worse, and yet still getting a sufficient effect out of the exercise to release those natural endorphins. Prevent contractures with poor mechanics, so maybe they're always using a walker, they get tight hip flexors here, they get reduced mobility at the hamstring, so we may be stretching to prevent those contractures, and then fatigue is a problem for these. Everything is focused on function, so we want to talk with them about their fatigue levels, and then maybe say to them, hey, let's look at things that you don't love to do that are fatiguing you and cut those out or get someone else to do them. If you don't love cleaning your house, let's hire a housekeeper if we can, so that way you maintain your function as long as possible and you don't over fatigue and end up injuring yourself. Ankylosing spondylitis. Now this is related a little bit to our rheumatoid arthritis. But we want to know about this because it causes some significant deformities and lack of mobility. So you can see this spine here, it looks wrong, something looks wrong with it. You'll notice how it's all fused together. These patients' bones fuse together. The hips will fuse, the spine will fuse, and they get caught up, so you can see normal posturing here. And by the end, he's bent over, he literally cannot stand up straight. because his bones are fused in that position. So the hips will fuse, the pelvis will fuse, everything limits this patient's mobility. So what are we doing? We are doing everything we can to maintain mobility as long as possible, but also modalities to reduce pain. We might work on a more upright posture. You'll notice they get very, very flexed and hunched over. So we're working on extension and upright posture. Stabilization, work in the pool may help with abdominal stability so that they can stay upright as long as possible. Here are your questions for muscular dystrophy. Pause, write them down, and then restart the video. With our patients with muscular dystrophy, the earlier the patient has signs, the worse the prognosis. So if they're showing signs at a very young age, they have a much worse prognosis. And muscular dystrophy can be very problematic because there are a wide variety of muscular dystrophies out there. There's 6 major types of muscular dystrophy. Probably the most common and the hereditary type that we know is Duchenne muscular dystrophy. One of the classic signs of muscular dystrophy is this thing called Gower's sign. Our patients lose proximal stability with muscular dystrophy. So they don't have strong hips, they don't have strong abdominal muscles, and we actually see that these kids will have good looking muscle, but it's not functioning well because we know that muscular dystrophy destroys the tissue of the muscle and replaces it with fat. So the muscle looks beautifully hypertrophied, so they'll have like nice guns and good solid looking calves and quadriceps, but they're not strong because that muscle is full of fat instead of muscle actual tissue. So Gower's sign is a way that a child gets up off the floor. Now normally you and I get up off of the floor in a very characteristic pattern, which we're going to talk about in a minute, but here you can see this boy is getting up. Now, what's unique about it is, look at how he's kind of floppy with the rollover here, and now he's going to kind of climb his way up. Now, this is where it's unique. So he's going to walk his hands all the way back, okay? And then you'll notice he's pushing up on his legs to kind of help push to stand up. He's lacking the core stability that he needs in order to stand all the way tall. Now, how does that differ? So you're going to get to see a video of my lovely little girl when she was quite a baby. So watch her walk herself back, and then notice how her trunk is going to come directly upright. She's going to get it under and push all the way up. So that is a normal way of standing up. So that use here of the hands is what Gower's sign is all about, that lack of core stability in standing. Classic sign of muscular dystrophy. So treatment-wise, they lose function very fast anytime they get hurt or injured. So we want to maintain function, function, function. Working on energy conservation, maybe deciding again, much like our rheumatoid arthritis people, what are the things that you have to do and what are the things that someone could do for you? Keeping their positioning and posture because they lack that core stability. They're at risk for contractures. They can get scoliosis because they're kind of slumped or slouched, or they can get really kyphotic. So we want to keep that core stability as long as possible and make sure that they are positioned correctly in any wheelchair or assistive device. Their cardiopulmonary system is going to lose function. Our diaphragm and our abdominal muscles are what helps us breathe. So as those lose function and that core stability reduces, we're going to have cardiopulmonary issues. Assistive devices as needed. Here's your quiz on Down syndrome. Pause here. Treatment for patients with Down syndrome. We will see these patients in our pediatric clinics because they have a pretty significant number of comorbidities. They have to maintain an active, healthy lifestyle. Otherwise, those comorbidities are going to be problematic with regards to weight, cardiopulmonary stuff. In general, these patients are hypotonic. They don't have enough muscle tone. So their muscles are flabby and they're not as strong. So strengthening is going to be very important with these patients. And then generalized strength will also help support their joints because these patients have a risk for laxity at their joints, so they're hypermobile at their joints, and hypo, decreased tone. So we want to strengthen and stabilize. And that is it. You have completed your pathology flashcards. Good job.